simpler. We actually need to start thinking about physical inactivity as a disease. We now know that it carries the same mortality risk as smoking, cardiovascular disease, and type 2 diabetes. Yet, when the average American reaches age 50, they lose about 10% of their peak muscle mass. By the time they reach age 70, they're losing about 40% of their peak muscle mass. And this isn't just about looking strong, it's about physical independence, it's about survival. So higher muscle mass is associated with a 30% lower all-cause mortality. Grip strength is actually a better predictor of cardiovascular-related mortality, the #1 killer in the United States, than high blood pressure, and yet nobody talks about it. And strength is also associated with a 42% lower dementia risk. And yet we think of resistance training as an add-on, as a luxury. It is not. It is a fundamental pillar of aging. It increases muscle mass, muscle strength, and bone mineral density. So fractures are a death sentence. Between 20 to 60% of Americans that have a hip fracture die within a year. And yet resistance training can lower fracture risk by 30 to 40%. This is preventable. We have the information, we have the data, we need to take action. And resistance training, exercise, getting the right foods are the most important things that we can do to prevent disease and make a difference in our country.